An average of 24 bodies are buried at New York City's Hart Island a day amid a surge in coroanvirus-related deaths, as Gov. Andrew Cuomo said the curve is beginning to flatten.
Cuomo added that the number of deaths in New York are stabilizing, but at a horrific rate, after 783 more people died.
It was announced by New York City officials that they've shortened the amount of time unclaimed bodies will be held before they are taken to Hart Island, the city's public cemetery.
The New York City Department of Corrections told The New York Times that begun to expand the number of burials on the island to around 24 a day.
This is approximately how many bodies would be buried at Hart Island in a week.
Under the new policy, the medical examiner's office will keep bodies in storage for just 14 days before they're buried in Potter's Field on Hart Island.
The city has used Hart Island to bury New Yorkers with no known next of kin or whose family are unable to arrange a funeral since the 19th century.
It's unclear if the recent increase in interments included COVID-19 victims or if they passed away before the outbreak and were being transported from morgues to make room for the newly dead.
Drone footage released Tuesday showed workers in hazmat suits digging large graves on Hart Island.
Typically, bodies are buried there once a week by low-paid Rikers Island jail inmates, but the Department of Corrections has since hired contracted laborers to carry out the work due to the outbreak.
That number of burials began increasing last month as the new coronavirus spread rapidly and New York became the epicenter of the pandemic.
The chief medical examiner's spokeswoman, Asia Worthy-Davis, said on Thursday it would take time to collate individual causes of death from the office's records, but that it was probable some of the recent burials include those felled by the coronavirus.
Meanwhile, local morgues and funeral homes are overwhelmed by the influx of deaths.
Brooklyn undertaker Thomas Cheeseman said funeral homes are so backed up, some people will inevitably end up being temporarily interred.
Cheeseman said the new deadlines are putting a strain on funeral homes as more and more families seek arrangements for loved ones fallen by coronavirus.
We, the funeral directors, are overwhelmed, Cheeseman said.
We're inundated. The crematory can't even take bodies for 2 weeks. The funeral homes don't have refrigerated trucks parked out front.
On Thursday, officials said they had no choice but to bury COVID-19 patients at the city's cemetery as it deals with the mounting coronavirus death toll and dwindling morgue space.
For social distancing and safety reasons, city-sentenced people in custody are not assisting in burials for the duration of the pandemic, DOC Press Secretary Jason Curson told DailyMail.com. Contracted laborers are performing this important work under DOC supervision.
Burial operations at the city cemetery remain uninterrupted and they continue to be supervised by DOC, which has been performing this solemn duty on Hart Island for over 150 years and will continue to do so until the jurisdiction of Hart Island moves to Parks in 2021.
This comes as Cuomo revealed that the state recorded an additional 738 deaths Friday, but the curve is flattening due to social distancing efforts.
The numbers are somewhat stabilizing, but it is stabilizing at a horrific rate, he said during a Saturday morning press conference.
Cuomo's claims align with reports that the 3-day average of hospitalizations and ICU admissions have fallen. There were only 85 hospitalizations on Friday.
In New York, there are more than 174,000 confirmed cases and at least 8,627 deaths. The city recorded 94,409 and a death toll of 5,429.
He added that New Yorkers must continue to practice social distancing, noting that people cannot let the anxiety of stay-in-place orders override logic.
As of Saturday, no decision has been made regarding reopening businesses but could be as early as May.
You start to hear this dialogue on reopening and you start to hear people with political theories on whether we should reopen fast or whether we should reopen sooner, he said.
Why are people against reopening? Why are people in favor of reopening? That is corrosive and destructive, and if we don't stop it, it will feed on itself, and there are no political conspiracies here.
In response to reporter questions about the upcoming presidential race, Cuomo said, "I'm governor of New York and that's where I'm going to stay."
He then claimed to have a strong relationship with President Trump, despite several public disagreements, and said Trump has really responded to New York's needs.
Trump announced Friday that a second White House task force would be created to focus on opening our country.
The second task force would have members who are very great doctors, business leaders and possibly members of Congress and state governors.
He said, "This is beyond economic. I call it the Opening Our Country Task Force or Opening Our Country Council, so we don't get it confused with the main White House task force."
Hundreds of people dying in their homes or on the street in New York City are not being included in the coronavirus death count even if they had symptoms, suggesting the city may be significantly undercounting its COVID-19 fatalities.
Data from the NYC Fire Department shows that 1,125 people died in their homes or on the street in the first 5 days of April alone, which is more than 8 times the number of deaths recorded this time last year when 131 people died.
The daily tally of residents who died at home with coronavirus-like symptoms exploded from 45 on March 20 to 241 on April 5, the data shows.
The fire department data is based on information collected during 911 calls involving cardiac or respiratory arrest with fever and cough, symptoms that are in line with severe coronavirus cases.
While those symptoms could also fit diseases such as influenza, the steep rise coincides with the surge in coronavirus cases and deaths in New York City.
Between March 20 and April 5, the number of coronavirus-like cases, including patients who survived, tripled from 94 to 322.
The percentage of calls in which paramedics could not save the person rose from 48% to 75%.
Paramedics have not been testing people for coronavirus if they die at home or on the street. It suggests that the soaring death toll from the virus could be much higher than currently reported.